Right, so now we have joining us Dr. Ram Sundaresh, who co-authored a groundbreaking study recently on incarceration and family health and all the consequences of that. Doctor, thank you so much for coming on the show tonight. I really appreciate it.
Hi, thanks so much for having me. It's good to be here.
Yeah, and if you can, I just want you to sort of explain the study. What were your findings, and what was sort of why was it so important for you to do this?
Yeah. So first of all, we were looking at, what are the effects on family members? I think it sounds like there's been like a really rich discussion already about what are the impacts of incarceration, how does that affect communities and our fabric of society, and there's already a lot of really strong data on all the different facets of life that get affected by incarceration. Financial, social, health impacts, and we wanted to explore further. Not only how does this affect family members, but what does this look like for their overall well-being? And by well-being, what we meant was what is the holistic quality of someone's life? Are they suffering? Are they surviving? Are they thriving? And what does that look like with these experiences? And I think a lot of people out there who have had family members incarcerated already experience this, and they know what that's like. And so we wanted to shed light on this with data, so we could show the rest of the world what these families already know about these experiences, that it really negatively impacts well-being. And we also wanted to look at, in addition to well-being, if we could calculate estimates of life expectancy, because there's already so much data on how much this affects health and different aspects of physical health and mental health, substance use. And we wanted to look at how does this affect health disparities. We know that there's such a large disproportionate impact of incarceration on Black and Brown communities. And we know that there's a lot of health disparities that these communities already face. And so we wanted to look at what are the associations with life expectancy when you start to look at these different family member incarceration experiences. And so the main things that we found are that perhaps not surprisingly, having a family member incarcerated is associated with lower well-being in basically every domain: physical health, mental health, social, financial, spiritual well-being. It's also associated with lower life expectancy. What we didn't expect was just how strong of an association that was. It's almost 2.6 years lower life expectancy for having an immediate family member incarcerated.
Wow.
So it's really profound, especially when you think about how many people out there have had a family member incarcerated, and just the repercussions on health and well-being and disparities in our nation.
Well, doctor, yeah, and as we discussed just previously, the United States is the world's leading prison state, and so I'm curious, what percentage of people surveyed reported having an incarcerated or formerly incarcerated family member, and did you guys break that down by race and gender?
We did. So about 45% of people in the United States overall have ever had a family member incarcerated, and within Black individuals, that number is even higher, 63%, and that really reflects just how different the system is based on who you are, and the amount of resources you have, and this is a very racialized system, which is not news, but just the sheer numbers is 63% of Black individuals having an immediate family member incarcerated is pretty mind-blowing when you just consider how many millions and millions of people that is.
Yeah, and on that note, what can you tell us about how incarceration specifically impacts the Black community and those families in particular?
Yeah, that's a really good question. So a lot of the research that's out there that have tried to tease apart what are the mechanisms of how this is actually playing out. For example, within the domain of physical health, people have less material support. They have a lot more stress. That manifests as having more chronic medical conditions that are harder to control. People have higher blood pressure. People are more overweight. There's a greater mental health effect. And when you look at, for example, all the different ways that different family member roles are affected, If you have, let's say your parents are incarcerated, then you don't have someone that's taking care of you. And that role may fall onto someone else who then has even more on their plate. And they're getting even more spread thin. It's harder for them to keep up with their job. It's harder for them to take care of their own health. And all these things start to snowball. If you have a spouse or a partner who's incarcerated, you have less emotional support. Your mental health is going to suffer. You have less social well-being. You're less engaged with your community. It's harder for you to access healthcare. All these different mechanisms are what's panning out in all the rest of the literature and what people are experiencing day to day.
And Doctor, I know for years women were the fastest growing part of the prison population, and obviously a lot of those women are mothers. Is there anything in your research sort of detailing the impact that's had on families as well?
So our research hasn't specifically looked at the mother-child relationship, but you're right. There is a lot of research that has, and there are a lot of negative consequences in both directions. Being the child of someone who's a mother who's incarcerated has a lot of negative outcomes, and being a mother who is themselves incarcerated has a lot of negative outcomes. And so it does go in both directions. Our particular study looked at kind of all comers. So we looked at all immediate family members as well as extended family members. So we looked at, partners, parents, children within immediate, and then within extended family members that goes out as far as, cousins, aunts, uncles, grandparents. And so we can really start to see these like intergenerational effects. And, for example, some of the previous literature has shown that, there definitely are these intergenerational effects. And, if you have an adult who's incarcerated, the grandparents or the elderly parents of that adult who is incarcerated then may have greater caregiving responsibilities. And that can affect mental health, that can affect finances, that can affect physical health. And so the same is certainly true of the mother-child relationship as well, and has really important implications for not only the racial disparities, but the gender disparities as well when we think about the disproportionate effect on women.
Yeah, and when I saw this study, to me, first I was sort of amazed, to be honest, because I don't think I ever saw anything like this before. Though there, people do look at the collateral consequences and everything like that, but not this sort of holistic approach to incarceration. What do you think lawmakers and policymakers can sort of leverage from this to try to help improve people's lives? I know obviously one answer is obviously decarceration. We just have too many people in jails and prison, but I'm just wondering what you think they can leverage to from this research that you did.
Yeah, definitely. So I think decarceration, that's the elephant in the room. The more we can decarcerate, the better we can prevent a lot of these negative outcomes that our data and so many other projects out there have been showing for years. There's a lot of different ways to decarcerate. We could talk about, jail diversion programs, better support for substance use disorders, economic support, social safety net programs. But, aside from decarceration, I think our work is also showing that these families really need a lot of help. They need a lot of support. They're taking a huge toll from having a family member incarcerated. And there are more things that we can do to support them materially, to support their physical health, supporting their mental health, providing more resources, counseling, more community resources for them to get support, job opportunities, housing, basically building up the social safety net, but especially for this group that's affected so strongly by their family members being incarcerated.
And Doctor, Rashad and I have covered incarceration, both as reporters in the field and also, with the podcast. And, in the previous segment here, we sort of described it as it's not just one person you put in a cage. It's and our guest said exponential. So I'd really just like to really flesh that out more for people, because I feel that this aspect of the mass incarceration crisis rarely gets mentioned. The family rarely gets mentioned, and that's why Rashad and I, we find this report so important. So please, if you could just talk about how when you take whoever it is, male or female, and you put them in a cage, some of those consequences to the other family members.
Yeah, absolutely. It's often invisible to people who haven't experienced it firsthand. And so when we look at the total pie chart of the U.S. population, it's roughly 330 million individuals in our country. The data set that we used, the initial team that had collected that data, their findings were showing that it's roughly 45% of all Americans with an immediate family member incarcerated, and around 63% of African Americans who've had a family member incarcerated. So when you take 63% of 330 million, that's well over 150 million people right there.
Wow.
It's 150 million people multiplied by this profound impact on every aspect of their life. And just to put it into perspective, so when we calculate these life expectancy projections, for an individual having 2.6 years lower life expectancy projection from an immediate family member incarcerated, that's similar to being incarcerated yourself.
Wow.
Which is that's mind-blowing to me.
It's incredible.
And it compounds from there. That people have multiple family members incarcerated, and it only gets worse. So what our data is showing is that if you've had 3 or more immediate family members incarcerated, that's equivalent to almost 4 years of life expectancy reduction. That's equivalent to having a heart attack. And so it's such a huge toll, and it really can't be understated. Multiplied by just how many millions and millions of people, over 150 million people who are likely in this group. It's tragic, and it's really sobering to think about how this unfolds in our society in every aspect. The finance. When we talk about our healthcare system falling apart, this is at the roots of that too. We have to grapple with criminal justice when we talk about health justice and health equity. Bridging that divide and health disparities between Black and white Americans. This is a large part of that. The role of incarceration and all the effects on family life, finances, and the fabric of community.
And Doctor, just really quick before we let you go, when was this research conducted? I'm just wondering if it was before or after COVID, because we all saw with COVID, just people were shut out from their families. They couldn't visit them personally. There was difficulties getting in touch. So I'm just wondering what impact COVID may have had on this research, if any.
Yeah. So this data was all collected before COVID. The data itself were collected from 2018, and it was analyzed around like 2019, 2020. So all of this was pre-COVID, but a lot of these issues only get further compounded by the pandemic itself. And there have been a lot of people working really hard to get people out of prisons and back into their communities, back into their homes, because just the social isolation and all these negative effects of being in the middle of a global pandemic, where it's so hard to even just survive and get by on your own, is just that much harder when you have a family member who is locked up and behind bars.
Just amazing work that you and your team did, the other researchers and authors. Dr. Sundaresh, we really appreciate it. How can people get their hands on this? As journalists, we're always trying to find studies and reports, but we know the general population isn't as adept at it. So how can people learn more about this?
Yeah, so there's a lot of ways to learn more. You can find our study by looking at JAMA Network, searching for Sundaresh family member incarceration. You can look it up there. My mentor, Dr. Emily Wong, is in charge of the SAGE Center for Health and Justice at Yale School of Medicine. That's another great resource to find a lot of different initiatives to address mass incarceration in our country. And then also just talking to people. I think what our data is showing is that it's just so common. You probably know people in your social network who've been affected by this, and listening to them and understanding what their experiences have been. is another way to just better get plugged into how this is affecting our country, because it's in our backyard, it's in our communities, and it's likely affecting people you already know.